In order to perform your hip replacement, your surgeon will need to gain access to your hip. There are several different ways your surgeon can do this, and we call this the hip approach. Your surgeon will be able to advise and discuss what approach they feel is the best option for you. If your surgeon approaches your hip from the front, we call this the anterior approach, and your wound will be at the front of your hip. If your surgeon approaches your hip from the side, we call this the lateral approach, and your wound will be on the side of your hip. After your surgery, the muscles and ligaments surrounding your hip may become stretched. It is important that while these muscles are recovering, you avoid certain movements that may put your new hip at risk. Whether you are having an anterior or lateral approach, we recommend following these movement precautions for 3 months or until your surgeon recommends otherwise. Precaution number 1, no crossing your legs. Imagine that there is a line running down the centre of your body from your head down to the floor. You don't want to cross your operated leg across this imaginary line. There are 4 main times that this could happen. 1, no crossing your legs while you're sitting in a chair. Number 2, no crossing your legs while you are lying in bed. Number 3, when you are getting out of bed, ensure your operated leg does not cross your midline. Because of this, we recommend getting in and out of bed on the same side as your operated leg. Number 4, if you choose to lie on your side, make sure that you pop a pillow in between your legs. This will stop your operated leg from crossing your midline. Precaution number 2, no twisting or pivoting on your leg. There are a couple of different times that this could happen. Number 1, when you are turning, try take small steps so that your feet are always pointing straight forwards, rather than pivoting on your operated leg. Number 2, if you are reaching, make sure you move your feet rather than twisting or pivoting on your operated leg. Precaution number 3, no hyperextension. This means we don't want you to stretch your hip by taking your leg too far behind you. There are a couple of different times that this can happen. Number 1, when getting out of bed, please ensure you don't drop your leg off the bed, as this will cause you to stretch the front of your hip. Number 2, when moving up the bed, please be mindful you don't push your hips up too high, as this may overstretch the front of your hip. Number 3, when you are performing your exercises, please ensure you don't push your leg back too far and overstretch the front of your hip.